Dear YouTubers and students, I am Dr. Ashok Rana. I will be discussing chronic hepatitis, an ailment which is usually not diagnosed in time and may lead to various complications. Now, before going further, I will request you to go to my app Dr. Ashok Rana from Google Play Store, Android phone, and you can download the app free of cost. And from the Apple iPhone, you can also download the app, but that is a paid app. From there, you will go to the Class Plus app where I will have put up all the lectures. Most of the topics have been covered, only few subjects have been pending, which I will cover in due course of time. So today's topic is on chronic hepatitis. So what is the definition of chronic hepatitis? It is defined as the long-term inflammation of the liver cells for the period of more than 6 months. So as you know, active hepatitis B, when the patient is suffering from viral hepatitis B, it takes about 3 to 6 months for complete recovery. So if the condition prolongs to more than 6 months, it is likely that the patient has gone into chronic active hepatitis. And as I have told in my viral hepatitis B lecture, which is present in the Class Plus app, that this chronic hepatitis, 10% patients of viral hepatitis B convert into chronic hepatitis. Now, what are the various etiological factors? As you know, liver is present on the right side of the hypochondria in the upper part of the abdomen, and spleen is present in the left hypochondria on the left side of the abdomen. Now, the various etiological factors are, first, most important is viral hepatitis B and C, and in some cases viral hepatitis D. But hepatitis B and C is quite notorious for this chronicity of hepatitis. Number 2, autoimmune hepatitis, as seen in various autoimmune disorders like SLE, PAN, polyarteritis nodosa, chronic rheumatoid arthritis, etc. When the immunity system of the person works against the body of that patient, that is called autoimmune hepatitis. Then third cause is alcohol, that is alcoholic liver disease, a patient who is continuously drinking alcohol or taking alcohol for a period of time more than 10 to 15 years, and that patient getting alcoholic hepatitis many times converts into chronic hepatitis. And then various drugs like amiodarone, methotrexate, paracetamol, gold salts, etc., they are also responsible for chronic hepatitis in certain group of patients. There is another condition that is called non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease. This is progression of the fatty liver, which is usually commented on the ultrasound examination of a patient who is having various other diseases in his body like diabetes, hypertension, obesity, and hypothyroidism, etc. Such patients are likely to go into non-alcoholic fatty liver disease. So these are important etiological factors. Now, what are the various clinical features? Early stages, the patient may not have any symptoms. He remains normal. Only the viral marker hepatitis B or hepatitis C will be present in the blood if the patient has been a known case of hepatitis B or C. Otherwise, there are no symptoms in the early stages. In the late stages, patient may have vague symptoms like low-grade fever, decreased appetite or loss of appetite, loss of weight, fatigue, joint pains, and feeling of nausea, vomiting, bloating in the abdomen, and passing dark colored urine and clay colored stools, etc. Some patients may present with pruritus of the skin, that means itching on the skin, and skin rashes. There may be certain patients who may present with palmar erythema. The palms, they become red, usually seen in alcoholic liver diseases. So these are important presentations in late stage of chronic hepatitis. Still later, if the patient doesn't take any treatment, he may present with complications of chronic hepatitis like cirrhosis of the liver, that will manifest in the form of its complications. Number 2, he may present with hepatic failure, and number 3, he may present with hepatocellular carcinoma, which is a very grave complication of chronic hepatitis and cirrhosis of liver, usually due to hepatitis B virus. As I have told in my hepatitis B lecture, 10% patients of hepatitis B may go into chronic hepatitis stage, and those patients may convert into hepatoma or hepatocellular carcinoma at a later stage. So to diagnose such a condition which has very grave implications, we have various diagnostic tools like blood examination for liver function tests like SGOT, SGPT, then prothrombin time index, GGTP, and serum alkaline phosphatase. Second investigation of choice is ultrasound or fibroscan of the abdomen of the liver for finding out the stage of the disease and to find out presence of splenic enlargement, because usually at a later stage in chronic hepatitis, spleen is also palpable. Then the third investigation is liver biopsy. Liver biopsy will settle the issue of chronic hepatitis. It's a histopathological examination and is done by a senior histopathologist in an institute. So where the diagnosis is confirmed, that is of chronic hepatitis. Then coming to the management. The management of chronic hepatitis is number 1, medications to treat viral hepatitis A or B, viral hepatitis B and C. Here I will make it clear that hepatitis A patients never go into chronic hepatitis. So hepatitis B and C patients are likely to go into chronic hepatitis. So treatment of those patients with various antiviral drugs like interferon, acyclovir, ribavirin, etc. It's a specialized treatment. Then second point in the treatment is stop the offending drug like methotrexate, paracetamol or amiodarone, etc., which the patient is taking, and that patient may recover in due course of time. Third part of treatment is liver transplantation. This transplantation is done at a higher center. In India, one of the pioneer centers is Institute of Liver and Biliary Diseases, New Delhi. Otherwise, at other hospitals like Gangaram Hospital, All India Institute of Medical Sciences, PGI Chandigarh, and then DMC, CMC Ludhiana, all these centers are also doing liver transplantation. So that is a bigger treatment plan for the patients who are suffering from chronic hepatitis and at a younger age. So with this, I will conclude the topic of chronic hepatitis, and I will again request you to go to my app and share this video with your other colleagues in your WhatsApp group, and medical students from other faculties like MBBS students and then BPT students, nursing students, all of them are likely to get the questions from this disease. So they may also look into this video. And with this, I will wish you all the best. Thank you.